Hello, friends. This is Sharon from Natural Awakenings, and I'm very pleased today to be able to speak with Dr. Imre from the, say it properly,
Nature Medicine Clinic in
Nature Medicine Clinic in Colts Neck. And Dr. Imre is going to help us identify what are the things that we can do to keep ourselves safe. How can we, if we feel at risk, how can we contact them to discuss what we're feeling and what we can do about it? So Dr. Imre, I'm really going to hand it over to you because I'm not a healthcare specialist and you are. So thank you for being with us today.
Great. Thank you, Sharon. Thanks so much for having me. This is actually why I love natural medicine, because even things like a novel virus where we don't really have many treatments, there are always things we can do naturopathically to really help support our immune system so that if it does come in contact with that virus, it's more able to work with it. So probably all of us have heard that kind of the number one thing we can do for prevention right now would be to not come into contact with the virus, right? So of course, that's not always possible. And so things that we're hearing about would be hand washing, number one, really important, both because the virus has a fatty capsule. And so soap can actually help break that down. Friction that you do while washing your hands, that's really what helps move particles off. So that's why the whole 20 to 30-second thing is important while washing your hands, getting the back, thumbs, all of that. And then, of course, avoiding touching your face, especially if you haven't washed your hands. And that's because the virus travels via respiratory droplets, which you can get from being within 6 feet of someone coughing or sneezing, or touching a surface that they have touched, then on your hands. And then if you touch your mouth, your nose, your eyes, those are all mucosal membranes that then can take up that virus. So really being mindful of that. And then of course, if you are coughing or sneezing, really, into your elbow or use a tissue and then make sure you wash your hands after that. Other things you can do would be nasal irrigation. So if you have a neti pot at home or saline rinse, something like that, and even gargling water, salt water, or just even regular water, both of those things, again, will help to kind of not let the virus attach to those mucous membranes in your nose and your throat, which is where it starts out. Other things, of course, if you're sick, really great if you can stay home just so you're not exposing other people, or even if there's someone in your household who's sick and you're not, really best for you to stay home, as there's many of us who could be asymptomatic carriers, meaning we don't have any symptoms yet, but we might be spreading it. So that's where this whole social distancing is important. And I'm not saying social isolation, like I don't want you to, be in a cave and never talk to anyone. That's not what I'm saying, because that can cause more stress, but really limiting where you're going, who you're exposed to, staying home as much as possible, and of course, keeping in contact with your friends and family, whether it's Skype or FaceTime or whatever that is, so you still have that social connection, because that's important. Other things at home would be having a humidifier going. It's found that viral particles actually have a harder time traveling in moist air than dry air. So that's something you could do at home. Again, none of this, yes. Yeah, none of this, of course, is proven exactly with coronaviruses, but just in terms of viruses in general, these are things. And then, of course, probably we're all wondering about supplements, and with the early on panic, a lot of supplements were bought up, sold out, all of that. So I don't want people to worry, because there are things you can do outside of supplements that can be just as helpful. You can get a lot of the nutrients that you would get from supplements from food and other things. So for example, vitamin D is really important. The best way, of course, to get that would to be go outside in the sunshine. So if you are staying home a lot, when it's sunny, really be outside all the time, because indoor pollution is actually generally worse than outdoor in terms of contaminants, particles, viruses, etc. So get outside. Sometimes you do need extra supplementation of vitamin D. So if you have that, great. If you don't, Don't panic about it. Vitamin A is another great one for immune support, and you can get that from things like egg yolks, cantaloupe, carrots, cod liver oil, spinach. Those are all great things. Zinc is another one we've probably heard about, and you can get that from oysters, from pine nuts, from pumpkin seeds. Beef is another source. And then vitamin C, also immune supportive. Bell peppers, strawberries, citrus. So what I'm painting here is this picture of kind of a colorful plate, right? So I know all of us are going shopping and we're stocking up on, what do we see missing in New Jersey? Pasta. That's what's gone from the shelves. And I understand that from a point of view of food lasting for a long time, but really right now is the most important time for us to be getting a lot of essential nutrients. So the way you can do that is really focusing on having a lot of produce each of your meals, colors of the rainbows. The Mediterranean diet is kind of what you're aiming for. So healthy fats, nuts and seeds, fishes, vegetables, that's what you're wanting. You can focus on spices like ginger and garlic, oregano. Mushrooms are really immune supportive. Green tea also has been shown to make you less likely to get upper respiratory infections. So drink some green tea.
Mhm.
And hydration, right? Hydration. Make sure you're drinking lots of water, both for clearing that throat, but also water is mucolytic, meaning it helps break up mucus, and we all need to be hydrated for our immune system to function properly. Coconut water is great, bone broth is great, plain water is great. And then the last two things I'd say would be making sure you're getting movement, exercise. So
Mhm.
don't just sit at home doing nothing, because you can, right? Increasing exercise, like a moderate level, will help to increase your white blood cells, which are your immune cells.
Let me
And
ask you this. For the people who feel like, oh my God, I can't leave my house, can they go for a walk around the block?
definitely, I highly encourage it. Definitely be getting outside, moving. And then likewise, sleep is also going to help increase those immune cells. So make sure you're getting at least 7.5 hours of sleep per night, because vice versa, if you're not getting that sleep, that's going to potentially decrease those immune cells. So sleep, exercise, movement, and then lastly, make sure you have tools for managing your stress. I know we're all anxious, stressed out right now, whether that be meditation, yoga, gratitude journaling, looking for the good things that are happening in the news. And just know that your practitioners are here for you. I'm sure, therapists, doctors, naturopaths, whatever they may be, they're probably accessible virtually or by phone at this point. So don't feel like you're alone in all of this.
And how are you offering that kind of assistance to your patients right now?
Yeah, so we at Nature Medicine Clinic are doing both virtual consults and by phone visits. So you can reach out to us. Our website is naturemedicineclinic.com. We're also on social media, Facebook and Instagram, Nature Medicine Clinic, and you can always call us as well.
All right. Well, that's wonderful. Thank you. That was such a great overview. And probably next week, I'd love to have you back, because people are going to be like, oh my God, I've been stuck in the house for a week. Now, what are the things I can do to really take control of my health now that I have this opportunity ahead of me? So, can we talk to you again next week?
Of course, I would love to. I really just want people to feel empowered, like there's something they can do, because really when there's a new virus like this, we all get panicked and we feel like it's out of control. But I just want you to know that there are things that you can be doing. And I hope that some of these things were helpful.
All right, that's very helpful. Thank you so much for your time this afternoon. I know you're very busy, so we appreciate it. And we look forward to talking to you again soon.
Thanks so much, Sharon.
Thank you, Kristen. Krista.
You got it.
Have a good afternoon.
You too.